things that government spends money on, healthcare is a proportion, right? It's 42%. And that percentage is actually shrinking, has been for the better part of the last decade. First chart on the health spending fact sheet. And the evidence is that Ontario actually is not wildly overspending on healthcare at all. In fact, we are 8th of 10 provinces. So we're near the bottom of the country in terms of spending on healthcare. Ontario has a 98% hospital occupancy rate. That is excessive. It is so high, I've never couldn't find another jurisdiction with that kind of hospital occupancy. It means that everyone who's living in a 100,000 person town or more, or even a 70,000 person town, has a hospital that is running at over 100% capacity likely, or has been at some point in the last 2 years. It means patients are on stretchers in hallways. It means your ERs are backlogged because there's no beds to admit people to. It means that surgeries are canceled because there's no beds to admit people to. It means all of those things. It means higher infection rates. It means overcrowding. And that's a major problem. We want to draw attention to that problem because in the provincial budget that was announced yesterday, they've announced a funding freeze for hospitals. 0% increase. That means less than the rate of inflation and population aging and population growth. And what does that mean for your communities? Cuts. It means cuts.
You guys are the experts because you either work or live in the field and access healthcare. Do not assume that the MPPs you're going to meet with know anything about healthcare. Make sure you try and get a commitment from the MPPs before you leave the meeting.
We're getting residents who are coming from hospital, who are coming into long-term care that are more complex care. They're requiring total care from the nursing staff, but they're sicker. They've got trachs, they've got tubes, things like that, which require more nursing hours, which aren't given.
I was able to give the real examples of from bedside nursing and real stories of patients who are going through this 24/7 and how families feel, how patients feel, and how we as frontline nurses feel for our patients.